Patients want things done much faster. This is a pretty fast world. And if you tend to say, and they come to you for teeth, they're not coming to you for implants. So which means that if you tell them that you're placing an implant and you've got to wait for a period of 3 months before you can have a tooth there, then at a level you become a villain in the entire episode, and you don't want that happening. So what are the ways that we are trying to bridge that lag time is to use the Osstell device. And I think that's proven to be a fairly good and predictable mechanism for us to know when to load an implant. Now, for instance, on the day of implant placement, when you look at the primary stability of the implant, assessing by the torque values, which you can very well graphically see on the 1023WNH, you get a very good mechanical stability. But this mechanical stability over a period of the next 2 weeks is going to slowly taper down, and then it's going to come down a little. And then you have the next phase, which is the biological stability, which comes from osseointegration, which starts a little slow, but then slowly it rises. Of course, there's a point at which both of these, the downward trend of the mechanical stability and the upward trend of the biological stability, will meet. But after that, it's the biological stability that takes over the osseointegration, and that is the reliable indicator of implant stability. Now, why then do we have to measure the implant stability at the time of implant placement or any time during this osseointegrative process? There is this big scope or room for us to evaluate this. Now, at the time of implant placement, even though we get good primary stability, one of the and that primary mechanical stability comes from the design of the implant, the way the threads compress the bone and the compression that exists between the implant and the surrounding bone. But if you leave it around for some time, even a short period of time, now when you tend to see that there is the viscoelastic property of bone is slowly gives way, and then as there is no further stress, the bone tends to become the viscosity of the bone tends to become more runny, which means that the implant is not as much primarily stable as the exact moment when you finally inserted it at the best possible torque. Now, one way to overcome this problem is to assess the ISQ values, in which the Osstell device helps us to measure. So, the Osstell uses the RFA technology, the radio frequency analysis technology, where you begin to test or to record the resonant frequency of the implant. So what happens is you send a wave and it records the resonance frequency of that particular implant through a small peg. It's called a smart peg, which attaches to the implant. So what that does is it helps us to identify what is the amount or total surface of the implant that's actually retained in active bone. Bone is like a sponge, so you have spaces, you have solid bone. So you want to actually assess how much of the implant surface is actually covered in bone, and which tends to give a more duller frequency, or what we call a higher ISQ value, above the range of 70. This is a very important and useful idea, but more important than the fact that you can load implants early, the other thing is to be able to test the progress of the implants. I can call the patient back in 5 weeks, 4 weeks and see if the progression of the biological stability is increasing or not. Similarly, even though I might have spent or given a lag time of 12 weeks for the patient, at the end of 12 weeks, if I find that the implant stability quotient is less than 70 or is less than 60 or 68, I don't want to be loading that particular implant. I would rather give a longer treatment time. Also in high risk patients, smokers, diabetics, if I have to make a decision as to whether at the time of implant placement I should have or I must use a larger diameter implant, or I have to wait for a longer healing time, those decisions are very easily made more objective by the use of the ISQ device or the Osstell device. I think from that perspective, it is a really useful and equipment to have, largely because it gives you a little more predictability in your outcome. It could help you save a lot of time. Most importantly, it can monitor the progress of the patient across a time period and tell you when it is safe and when it is not so safe to load the implant. So from these perspectives, I think the entire spectrum of equipment that W&H has generally come up with, and the kind of support that we get through their technology and through their service and the quality of their equipment, I think that's impeccable. It's been a big support for us over many years, and this Osstell device is a newer addition, and I'm sure that we are going to use this a lot more frequently, and so that our patients can benefit. And I think the last person to complain when you get a faster treatment time is the patient. Patients are always happy if they can have faster treatment times, more predictable outcomes, and you can record and manage these records and maintain these records over a period of time. So I think it is a big plus in every practice, and we are really happy to have the newer equipment.